Liberia signs onto all these concessions and conventions and agreements globally that as countries or member states, we want to do this during certain periods. So we know that there's a sustainable development goal that has been in existence since around 2013, so forth. And up to 2030, the sustainable development goal is supposed to end. Liberia has signed onto the sustainable development goals. And so we are obliged to ensure that these interventions we have signed, these consent or agreements, or rather we have signed, our heads of agencies have signed, or head of country have signed, we are under obligation to ensure that we implement. So when we address drug abuse, we contribute to at least four of the sustainable development goals. Four of them. So what are the sustainable development goals and how do we contribute? One, when we address drug abuse, we contribute to goal number 3. The sustainable development goal number 3 talks about good health and well-being. And good health and well-being, like we said, drug abuse undermines that. So if you take care of drug abuse, you are actually contributing to goal number 3, which is good health and well-being. And by the way, under goal number 3, goal number 3.5, which is a sub goal, talks about the fight against substance use disorder, which is drug abuse. So directly, you are impacting or you're contributing to the sustainable development goal. Beyond goal number 3, you contribute to goal number 4, which is quality education. When people are not abusing drugs, you prevent school dropout. And by doing that, young people can go on to get proper education, acquire a career and become productive. And when they become productive, it means that we also contribute to goal number 8. Goal number 8 talks about decent work and economic growth. When people are productive, they can work productively and contribute to their community, contribute to the nation building, contribute to national development, and the human capital is enhanced because people are being educated and they're acquiring careers. So we directly contribute to goal number 8, which is decent work and economic growth. So the final goal we contribute to also is goal number 16, which is peace, justice, and strong institutions. Again, when there's too much drug abuse, the problem about drug in the country, people abusing drug, many times they engage in the criminal and violent behavior. That is the opposite of peace. And so if people are getting involved in the criminal act and everything, who did the justice system will be spending all the money to run behind people who are into drug. At the end of the day, that is, there's a weakened justice system. So when we fight drug abuse, we actually contribute to sustainable goal number 16. So it's 3, 4, 8, and 16. We directly contribute to them. Many of the other goals we contribute indirectly, but those ones we contribute directly. Now, these are clear justifications, and if these justifications are not enough to convince us as Liberians that we should tackle drug abuse together, then I'm not sure what else should convince us, because the future of our country is at stake as the result of drug abuse. Now, having said that, I would like to just highlight that the action plan that we develop has a vision. What do we want to see as a country? We want to see a drug-free, healthy, and safe Liberia. That is what we want. We want a drug-free, healthy, and safe Liberia. And then all the things we will do together will be the mission. That's what we want to achieve. So this action plan that we developed is guided by a few principles. What are the principles? We call them guiding principles. Those principles include the fact that everything we do, we should consider human right and dignity. So human right and dignity remains a major principle as part of our intervention to tackle drug abuse. The next thing is inclusivity and equity. Liberia is not Monrovia, for example. So we have a responsibility that every intervention that we plan in this action plan should reach the length and breadth of this country. That's equity. Everybody, everywhere should have access, and those especially who are who have vulnerability, those who are underserved, they should be able to benefit whatever we're trying to do. So that is equity and inclusivity, making sure everyone is on the table and everyone benefits. The next principle is public health approach. We should consider it as a public health issue, and the principles of public health should apply. We should consider the rule of law. Whatever we intend to do should be evidence based. We don't want to, it's not magic we're performing. Whatever we want to do, there must be existing evidence to show that this action works, and that's why we should do it. All right. Additionally, it should be multi-sectoral, meaning that it should involve all the agencies whose work will be relevant to the intervention. It should also be built on resilience and sustainability. Whatever we're doing, we should put systems into place that it will last. Our interventions will last beyond a government regime. It will last beyond a year or so. So everything we want to do, we should look at the sustainability. How can it continue beyond the time that some of us are in the role? How can it continue? The Honorable Minister of Health is the chair of the multi-sectoral committee, but obviously she's not going to be there forever. So when she has left, although she had this vision, she drove us through strong leadership to develop this plan, and we are implementing. But when she's gone, when she's no longer on the scene, what happens? We want this action plan to be sustainable. It should go beyond. And then, very importantly, it should involve community participation. When community own up to an intervention, chances are high that it can be sustainable and that it can be successful, because we are the community. So all of us should be a part. So these are very critical guiding principles that I just thought to highlight, that all of us have a role to play in whatever we do to fight drugs. Should really, really consider all these principles. Now, having
Now,
said
having
that, let me
said
give you.
that, let me
Oops, sorry. Do you hear me?
Yes, we hear you.
Okay, okay. Sorry, I got a terrible feedback. So now, what does this action plan contain in terms of the things we say we will do? So there are three pillars. We call them strategic pillars. What are those pillars? Pillar number one talks about drug demand reduction. And by the way, some of these concepts are technical, so I will really try to break it down so we understand, and I hope so far we're following. But the first pillar is drug demand reduction. What does that mean, drug demand reduction? It means that the people who are supposed to buy this drug, the people who are supposed to use this drug, they should have no use for it. So the demand shouldn't be there. And how do we do that? There are two priority areas there. The first one, we say we should do a lot of prevention and education so people understand the danger associated with drug abuse, so that they wouldn't use drugs, so they wouldn't buy drugs. So we want to reduce demand. So drug is a market. There's a seller and there's a buyer. So the first thing we say we want to do is all the people who are supposed to buy this drug, we want to discourage them from buying the drugs. So that's why I said the first priority area talks about prevention and education. The second priority area talks about, the first priority area, so pillar number one has two priority areas. The first one is prevention and education, and the second one is treatment, harm reduction, rehabilitation, and social reintegration. This is about treating people who already are using drugs. Probably they just started, or they already been using drugs for a long time. We want to treat them so they can no longer continue using drugs. When they are no longer using drugs, they will no longer buy drugs. And when they no longer buy drugs, it means the demand for drugs will go down. Eventually, the supplier will get out of business because nobody is buying. So we want to do that. So all of that, those two priority areas fall under strategic pillar number one. Strategic pillar number two, which is the second part, talks about drug supply reduction. While it is true that we are trying to reduce demand, that is, we don't want people to buy drug and use drug, we also have to make sure that drug is not available for people to even think about buying it. So that talks about drug supply reduction. There are three priority areas there. What are they? Number one, we say law enforcement and control. We have to do everything possible to control the availability of drugs. The second part talks about control and regulation of medical controlled substances and their precursors. What does this mean? In other countries, including the United States, currently they are struggling with what we call opioid abuse. Now, opioid, including fentanyl, is one of the very difficult drugs to treat. But the point is, opioids are actual medications. Many of the opioids are actual medication. They have medical uses, but because they have the risk of being abused, so they are tightly controlled. So in the US, one of their problems came as a result of a lot of prescription of opioids. So many people started using opioid for medical reasons and they got addicted to it. So by the time they got addicted to it, then it became a problem. When they didn't find the medical use or the medically prescribed opioid, they would go and buy some other things, some illicit drugs in the street that are also opioids and can also give them, a desired effect that they want. So now America is struggling with fentanyl and other opioids because people at some point in time had liberal prescription of opioids. What we want to do in Liberia is how well we can control the opioids, which are medical products, how tightly we can control them to make sure that they're not readily available and that people can start using them and become addicted. So that is the second, the second priority area under the pillar two. Then the third priority area will talk about the legal and judicial reform. What do we want to do? We want to keep reviewing our laws, our drug law in Liberia. We review it in 2023. We want to keep reviewing all the existing laws and guidelines and everything on all these illicit substances. We want to keep reviewing and keep updating as needed so that we can tighten the restriction and make sure that we deal with the supply. All right. So that is the second pillar, and those are the three priority areas under there. For the third pillar, it is more about how we bring it all together to function. So the third pillar talks about governance, coordination, and evidence for decision making. So we want the fight against drug to be well coordinated. We want to have strong institutions, strong leadership, and then we should have evidence for everything we do. Research, data, they should inform all the things we say we want to do as a country. So that is the third strategic pillar. There are two priority areas under there. The first one talks about governance, policy, and coordination. And then the second priority area there is research, monitoring, and evaluation. So we just want to make sure that this whole thing that we say we want to do, we should do it properly. This is all we are explaining. Okay. So just to run through quickly and tell you what some of these priority areas are and what some of the interventions that we want to do include. For example, when we look at priority area number one, let's start from number one. We say we want to do prevention and education. So what exactly we say we want to do? We say we want to do community-based prevention program. As we speak, what are we doing? We are working with communities. We are having education in communities. We're having awareness. We are working with families in communities. So that's community-based prevention. A lot of education. We also are doing school-based programs, working with students, young people. So we say we will do that. It's a strategy. It's part of the things we are actually doing. Then public awareness campaigns. Now we have public awareness campaign using mass media, social media, and so forth. So for example, this is a public awareness, public education forum now. And so we're educating people about drug abuse. We do that from time to time in Liberia across different radio stations and so forth. Okay. Then we also want to do what we call parenting and family support. Now, it has been shown by evidence that the risk of drug abuse in families that are dysfunctional, meaning families that are problematic, families that do not have good parenting style, the risk of drug abuse in our family among children is very high. So when you work with families very well, teach them parenting skills and so forth, you reduce the risk of children abusing drugs in families. So we have parenting and family support program as part of the intervention. The second priority area we said treatment, harm reduction, rehabilitation, and social reintegration, right? So what do we want to do here? What are the key strategies we have? Number one, we want to expand treatment facilities. In Liberia, unfortunately, as a country, we really did not have national drug treatment facilities. We did not have them. But as we speak, we have a number of facilities running under the government directly, and then we have a lot more being run by private providers, NGOs, and other organizations, and we are working with them, faith-based healers, as faith-based institutions, and we are working with them directly to strengthen how well they're providing care. So we, by doing that, we are expanding treatment facilities so more people can have access to drug treatment programs. All right. Beyond that, we are ensuring that whatever services are delivered in Liberia, they are by the evidence. We know typically people do different things. People want to help. So people, they come up with an idea, they use different methods that they believe can work. But we need to make sure that whatever people will be doing as a way of treating drug abuse, that those things that they are doing are based on evidence. Okay, so we are ensuring that evidence-based modalities are the ones that we are using in Liberia. The third strategy there is what we call harm reduction. Now, harm reduction is where you have people using drugs, but you work with them at the time they are still using drug while encouraging them to stop using drug. You work with them to arrest other risks that they have. For example, somebody using drug, for example, a lady is using drugs, she's abusing drugs, she usually gets involved into commercial sex as a way of sustaining her drug use, but you don't want her to get HIV. You are encouraging her to quit. You provide support so that she does not get HIV, for example, or she does not get hepatitis. Those, and we call them harm reduction methods. You work with them, educate them so that they know about overdose and how to prevent overdose. Those are things that you work with them about. HIV, hepatitis, TB, those are things you can reach out and work with them, teach them how to protect themselves, although they're still using drug. So we call that harm reduction. It's part of the intervention we have. Then we have social reintegration, and then how to refer them to treatment. For the third priority area, we should talk about law enforcement and control. What we want to do, we want to tighten our borders, employ technology and anything possible that we can use to intercept traffickers. We need to do better. So some of the things that we've been doing, some of the plans that we have, for example, increase the number of people at the borders, have new deployment, rotate the commanders, because when they get comfortable in a particular space, a lot can really happen. So those are things that have been happening. We are tightening the border. And recently, for example, the LDA had additional manpower trained and they are being deployed and all of that. As we speak, efforts are being made to procure a lot of equipment. Some of these technologies that people are using at borders, many of these things, we need to get them so that we can tighten our border and we can be able to intercept drugs that's going in and out. Okay, intelligence gathering and collaboration. Again, drug, that we know drug most of the time is transnational. It's happening from different places. So you work with a lot of security institutions across the region and beyond, so that you can get intel in time and be able to intercept many of the interdiction we do. Many of the things we do to arrest drug is not LDA sitting there just knowing that people bring in drug. No, it is intelligence. So we want to strengthen our intelligence, how we are able to intercept, from information we receive. We want to also tackle organized crimes. Now, people who involve into drug abuse, they don't do that as only drug abuse. They get involved in money laundering, they get involved sometimes in human trafficking and so forth. So those things together, they are called organized crime. Many people are in the chain. So we have to be able to work, strengthen our system such that we're able to target people at different levels. All right. And then the next one on this priority area is what we call proportional enforcement. Proportional enforcement is wherein when we arrest somebody who has a small parcel of drug, that was intended for personal use, how do we treat that person versus the person who trafficking, huge consignment of drugs? So it's proportional. That means the penalty you get for drug related offenses should be directly proportional to the gravity of the crime. So that's what we call proportional sentencing. So those are the strategies that we are employing, and those are the strategies that the action plan has clearly laid out that we should do. Priority area 4, which talk about the control of medical control substances. Here we want to be able to tighten our regular pharmaceutical practice in Liberia. One of the problems we've had is people can just walk to drugstore and buy any medicine. Now, this action plan is insisting and directing us so that medications that have potentials of abuse, including the opioids, the benzodiazepines, for example, that there's tight restriction and control so that those medications are only available in certain pharmacies. And by the way, some time ago, the Honorable Minister issued a ban that came along with the Shisha ban that talked about tight restriction of opioids not being available in any other area. So those are the kind of interventions. So we need to strengthen, our compliance mechanism. We need to strengthen the data system to know how people are moving drug, how people, how drug individuals who sell these medicines are clearly controlled so that the drug medications are not diverted for abuse purpose. Okay. Then priority area 5 talk about legal and judicial reform. I already mentioned it. So we want to review our national drug laws. We want to train the people in the justice system to understand what the drug law says. And then importantly here, there's something we call alternative to incarceration. We want to do that. Wherein when we arrest people who are involved with drugs, and for sure they are committing crime, but because they are users, we should be able to find a way to send them to treatment instead of sending them to prison. So there's a mechanism we call alternative to incarceration. So you should go to rehabilitation instead of being incarcerated. So that is an intervention that the action plan also clearly outlines.
Okay.
Then the justice sector, that sorry, I'm getting a feedback. Maybe somebody should mute.
Okay. Is it me?
Um,
Oh,
yes, the feedback is still there. So maybe if you meet, okay, I think it's gone.
I think that's from you, Archie.
Okay, we're good. I'm not getting the feedback anymore. Yeah.
Okay.
So yeah, legal and judicial reforms, all these things involving the criminal justice system that we can do to help people, take treatment instead of going to prison when they commit minor drug offenses such as being users and then you are in possession of small quantity of drug for personal use. We want the system such that we are able to track people who are diverted from the criminal justice system. Now the point there is when you have a system that is not strengthened enough, there's a possibility for you to say, okay, this man is a user and he has he has committed a minor drug offense, but the moment you letting that man off the hook, next thing he go into another place and he's leaving rehab, he's not committing to rehab. So we need to strengthen all those systems so that when people are giving alternative to rehabilitation, they don't end up in the street again, simply because they're trying to avoid prison. So those are the kind of things that this action plan has pointed out that we will be implementing. By the way, we have these programs, we need to strengthen them, working with the Ministry of Justice and the Bureau of Corrections. Area number 6, we are
Thank
concerned about governance, policy, and coordination. So here we want to make sure that the governance system is strengthened and that is permanent. And I will mention a bit what we intend to do about that. We want to make sure that the policy, what this policy is saying, should align with other national development policies. All right. We want to make sure also that community mobilization and civil society engagement is at the center of what we do. If you work in isolation of the community, your outcome many times cannot be what you desire because the community, which is the major stakeholder, is not involved. So we want to make sure that community mobilization and civil society engagement is key. Next thing, we want to ensure strategic mobilization or resource mobilization and financial stewardship. We need to find money to fight drug itself is a trade. There's too much money behind it. So those who push the drug trade forward, they have a lot of money. So if you want to counter it, you also have to really invest. So we need a strategic resource mobilization structure, and so that we are generating fund. But beyond that, when we generate this fund, we have actual prudent stewardship, so that people who manage these funds are accountable. So we have to ensure all of that. We also need international cooperation and strategic partnership. You can't fight drug alone as a country. You need a lot of hands on deck, international partners, and so forth. So those are things that we want to do under this priority area. Then finally, for the priority areas, we want to do research, monitoring, and evaluation. And I will comment a bit what work we are doing around that. So the key strategies include, one of the things we thought about is National Drug Observatory. And by the way, we are in the process of developing this now. We want a database, a national database that tracks every information we really need as it relates to fighting drugs. You know, how many people are arrested, how many people have been persecuted, how many people are indicted, those arrested, where they are, what is their current location. All those things, we want to have a database that will track it live, so that we're able to follow. Next thing, we want to be able to do national surveys and research. As a country, like I said, we don't have a national, research or national survey that has happened before, that is really representative of the country. But as we speak, we are currently in the process. We've submitted for the IRB approval, and so that means the research is currently on the way for the first time in Liberia, to be able to understand what the drug abuse situation is, the prevalence, what kind of drug people using, and all of that. So that's one major step forward that we're currently working on. We should be able to evaluate whatever we are doing. So impact evaluation is crucial. Again, you design a program and you implement it, you have to evaluate it. So we also have impact evaluation, and then reporting and accountability being major components of this fight against drug, or according to the action plan. So with that, how do we intend to implement this action plan? First of all, we said it should be multi-sectoral, meaning it should involve everyone. So broadly, we divided it into like four categories of people. So number one, there's government institutions. So the Ministry of Health, Ministry of Justice, the Liberia Drug Enforcement Agency, the Ministry of Youth and Sports, Gender, Finance, Education, Ministry of Information. Now it's local government, Ministry of Local Government, Ministry of Agriculture, and so forth. So all these government ministries and agencies that have crucial role to play, they should all be part of the fight directly as part of the committee. The second set of institutions should include civil society organizations and community-based organizations. Civil society is very key. Like we say, they are the watchdog. They contribute a lot. They help with education. They help with stigma control and all of that. So they do a lot. So civil society is a part of the committee. The next is development partners and international organizations. The one UN, for example, ECOWAS, for example, the UNODC, they are all interested. They are all major stakeholders in fighting drug in the various countries. So those are all international organizations that are part of the multi-sectoral committee as well. And then the last, but by no means the least, will be local communities. We want community ownership, and I couldn't emphasize this a lot more. So
So
with
with
this,
this,
okay, so with this, someone will ask, how do we intend to fund this whole thing? Like, we need money, but how do we get the money to fund this whole thing? Again, it's difficult to get money, in the midst of all the priorities. You want to invest in other things, you want to invest in infrastructure, building the roads, building schools, building health activity, building health facilities and so forth. So someone would say, then how do we get money to really fund this intervention? We believe that we should be intentional and look for multiple streams to be able to fund this fight against drugs. So as a result of this, we are currently in the process of doing two critical things. I will talk about the other one right after here. But the first thing is that we want to establish, and we are in the process of
That
establishing a national
Dr.
drug
Dr.
rehabilitation
Zia,
fund.
Dr. Zia,
Yes.
I don't want
Yes.
to. We have to go on the line, and the
Yeah,
people.
Mr. Nubo, lie him finish. Let him finish. I think he close enough.
Okay.
Okay. Thank you.
Just
Oh, someone has to mute. Okay.
okay.
Yeah.
I'm muting or just okay.
Okay. All right. So how do we fund this? We want to establish a national drug rehabilitation fund. So we want a dedicated account where we're able to pool multiple resources to ensure that we have what it is to fund the interventions. So this National Drug Rehabilitation Fund will look at different revenue streams. So for example, we'll be looking at government allotment. So every year the government has to allot money to fight drugs. So that is one resource stream. Next, we'll be looking at tax levies. Now, one of the things that we observe is that there are some legal substances, including alcohol and tobacco products. Those are legal substances, but they lead to drug addiction. They lead to addiction. Alcohol can lead to addiction. Tobacco, people can have addiction to that. So those commodities that have potential for causing addiction should be the commodities that will help to treat people who get addicted. So we call that tax levies or sin tax. So we're hoping that under the right mechanism, we will get some money from the taxes given by these products, so that we can contribute to fighting drugs. The next thing is forfeited assets. Our drug law says when you arrest people who are involved in drug, trafficking or dealing, and you confiscate their properties, it should be forfeited at the end of the day once they've been prosecuted, and the judicial system has cleared them and they are convicted. We should confiscate the properties. Now those properties should be sold or liquidated, and then funding from there should support the fight against drug abuse. So similarly, we expect that monies from those kind of things will also support this rehabilitation fund. And then contribution from partners. There are a lot of partners in the space who can contribute from time to time. Then corporate social responsibility. We have concessions in this country, and they're doing their business, and they know that if the country is not stable, if drug abuse remains a crisis, it threatens their investment. So it is only fair that they themselves also contribute something, so that together we can fight drugs. And then the last investment streams will be public-private partnerships. NGOs and organizations who want to help, we work with them so that they can implement some of the things, so that they can provide help. We can also do fundraisers. We can do national fundraisers. We can have private donors. So people, for example, from the states who are interested in how we're fighting drugs and how they want to help, they can contribute directly. So this is how we want to generate resources. Then whatever we do, we need to monitor it closely. We need to monitor it closely. So the last thing I want to talk about is that we have different levels of leadership, which is the governance structure. So we have what we call the multi-sectoral steering committee. So they're where there's the head of agency, like the ministers and our principal deputies, they're where they sit, and their role is to provide leadership and oversight over everything we do. Then we have the second level of governance, which is called the National Multi-Sectoral Technical Working Group on Drugs and Substance Abuse. Now, for example, there where I sit as the chair. So that particular leadership level is made of technicians who actually contribute to developing the interventions and implementing. Then we have the third level, which is the the county anti-drug committees. We want every county to own a fight. They have their own structure. They have everything it takes, pulling all the stakeholders in those counties to ensure that the fight against drug is happening at the county level and that the county is owning it. And then the final one is what we call the community anti-drug action teams. So we, under the leadership and vision of the Minister of Health, we work with local government representatives and leaders to ensure that we establish something called the community anti-drug action teams. So it means every community will have a cross section of a representative across the divide, the elderly, the young, the male, the female, the religious leader, traditional leaders, everybody to have small teams to form part, of the fight against drugs, so that these people are actually, they have the responsibility to protect their community, against drugs, and then help with the implementation of this action plan. So basically, I know it's very comprehensive, but with this, you can clearly ask any question along the line of what the action plan says, and perhaps what have we been doing, what are some of the things we've done. So generally, this is where I would like to land, and then just turn back over to you, the host in studio, and thank you for giving me the opportunity.
Thank you, Dr. Moses Zia the second. Let me applaud you for such a comprehensive, well thought out, chronological, presentation. I think you did yourself justice today. And to many of your followers who are in the comment section and cheering you on, I've seen it on all Western Monrovia tonight, in the comment section. Welcome to the show, guys. You really love your bus. But yes, at this point, we do have it's almost 2 to 11 in Liberia there, and 2 to 7 p.m. here. So let's do the doc. We're going to go to the lines because I really want the people listening out there to participate. So let's go to the lines and take few questions, and then we're going to come back, and then you will engage with the rest of the panel. Um, Chris, are you there?
Yeah, I'm here.
Okay, thank you. Okay, thank you. Chris, take at least 5 questions. At least 5 questions. 5 questions.
Okay, then, folks, we'd like to say thank you. Let's go to the phone line and talk to our first caller. Good evening and welcome, sir.
Mr. Chris, beware.
Yes, sir.
Are we live?
Yeah, of course. We're live.
Confirm if our professors are getting us clearly.
Yeah, Mr. Numo, Mr. Wright, are you guys are getting all Dr. Moses? Yeah, you guys are getting all you can just show all your thumb.
Yes, we're getting loud and clear. We're getting loud and clear.
Yes, we are.
Thank you so much. You can go ahead, sir.
Thank you. Let me say the pleasant good evening to all of our professors. Welcome in class. Again, they have demonstrated the high level of professionalism by bringing in one of Liberia's youngest doctor. I'm so proud of him in my comment section. I'm proud of him. Liberia is proud of him. Congratulations, sir. Here's my 2 questions quickly. One, do you people have the prosecuting power? Take, for example, if one is being caught into the spider web by your team, as to whether you got prosecuting power. My second question would be, how do you support yourself in terms of financing? Is it from the government angle or from donors outside of governmental institutions? Because your institutions mean well for our people of this country, and it's possible for Africa at large. So whether you're being sponsored by government institutions or a donor that is not governmental institutions.
Thank you.
Thank you for having us. My name is retired Captain Emmanuel S. Doe, otherwise known as Medicatu. You don't force, but you compare to do us the right thing. Thank you, sir.
Thank you. You're not full, but you compare to do all the right thing. Thank you for being part of the platform. Caller 0881 14 35 04 0776 105. You're gonna be live tonight. 5 callers, 5 questions or recommendation or comment. You listen carefully too. Yeah, just what with the cartoon said, the youngest. I go on social media, go see the man. Young man. Yeah, Dr. Moses Zia the second. Quarter 088143504 0776 105 105 088143504. And let's go to the phone line and talk to this. We love the caller. You can call her back on 088143504 0776 105 105. And you're going to be live 1 minute past the hour of 11 o'clock for Liberia time. So whatever you're doing and however the case may be, like this is your regular and more, talk about program on Top FM 105.3 that comes your way from Monday to Saturday. So let's hear you tonight. You listen to the one of the youngest. I talked to this caller. Hello.
Yeah, hello, good evening.
Good evening. What is your name and where you calling up from?
I'm Michael J calling from 2 Street.
Okay. Let's hear you, Mr. Michael Gill.
I would like to commend the director in studio.
Mm.
Yeah. For everything they are doing for the Liberian people. Yeah. That is why it's good to put responsible government in power. I just called to commend him. Thank you very much.
Thank you, Mr. Michael Gay, for even calling to commend the youngest director. Thank you for being part of the platform. Call on 0881 1435 04 0776 105 105 0881 1435 04 0776 105 105. And you're going to be live tonight. Yes, indeed. You listen to the two in most, two questions that with a cartoon, not food, but you compare. Are they having the power of prosecution? That is one. Or the other question was, who's supporting them? Is it the government or donors out there? Because that two things, is people supporting you. The government supporting you, how will you get power too much? Call on 0881 1435 04 0776 105 105. And you're going to be live. You listen to the daughter, giving the basis. From 1 to 5, from 1 to 2, they are away. Before the child have 1 year, that's certain thing. And when the 1 year come in, before 2 years, I like the way, Mr. Dr.
Chris.
Yes, sir. Yes.
If you don't have a caller, you can bring it back.
Yeah, we have caller here already.
Okay, thank you
Mm-hmm.
for connect. I'm Alex Angele Jr., calling from my LFE community resident.
Okay.
Let me appreciate the studio guests for the information provided.
Mm.
And when it comes to the question that was asked by Bulitatu, this once I don't know if that organization or what or it's a group that have been funded in the process, but what we need, let it be autonomous in the process to seek other support from international institutions. Because when you seek support from the government, definitely you will not be self-supported in the process. Whatever the government says in the process, that's what you do. But once you stand up to say you want to be part of what or civil society, definitely you remind government of other wrongs and you implement whatever you have as a goal or agenda. And the people of Liberia will be happy to eradicate other things that is not good for the society. So I want to say thank you to him. Let all of us continue to do well.
Your name again, sir?
I'm Alex M. Jr.
Alex, thank you so much. Thank
Welcome.
you so much. Let's go to the phone line and talk to Bude Cartoon. Welcome back, sir.
When we are in class and the topic being provided by the professor is very interesting, then it's also important for the student to raise finger and ask questions from the class time.
Mm-hmm. Mm-hmm.
My last question will be, do our doctor have uh, people assigned maybe in the rural counties? If yes, how do one get around there in terms of maybe giving them information, especially when it comes to illicit drugs activity? If they got people in the rural countries, if yes, how do one get around them? Thank you.
But a cartoon, you're not forced, but you compare. Thank you so much. Thank you so much. We can get our last caller and go over to our panelists. Let's go to the phone line and talk to this caller. Hello.
Yeah, good evening.
Yeah, Mr. Emma Williams, let hear you.
Yeah, thank you very much for that organization. I want to ask one question.
Mhm.
Yeah, as a Liberian, what can we do today? How we can manage to protect drug dealing in Liberia? And on what condition? Thank you. This is my way. Thank you. That's my question I want to ask.
Okay, thank you, Mr. William. Thank you for your question. As a Liberian, what can we do today and how can we manage when it comes to the drug issue? Thank you for that question. Uh, Mr. Wright, I think we can go over to you guys.
Thank you so much. Thank you so much. Thank you so much. Thank you so much. All right. Thank you so much, Mr. Wool, Mr. Ware. Gosh. All right, and thanks to all of our callers tonight for being part of the show. I always say, sometimes I think it's too late for you, but you're always proving wrong. It's good. So, Doc, this is what we want to do. I would really appreciate you to keep the response very, very concise because I want to go around the table so the rest of the panelists can be able to engage you. All right. So let's come to you so that you can be able to respond to the callers, and then we'll go around the table.
Okay, thank you to the callers for joining the conversation. Mr. Doe, quickly, let me look at your three questions. One, you asked whether we have the prosecutorial power. So this is a multi-sectoral committee made of various government ministries and agencies, as well as civil society and international partners. So the Ministry of Justice is the co-chair to this committee. So certainly everything around persecution falls in line with the Justice Ministry and the judiciary. So they work directly. So yes, we do as a committee. This committee is everybody's committee, like I said. The second thing is, how are we financed? So currently the government of Liberia is funding the interventions that we are doing. Of course, the government is the biggest funder of what we are doing. However, we continue to work with some development partners like the One UN, so they provide some support from time to time to do specific interventions. And we continue to also leverage on other opportunities like some local organizations who are also in the space fighting drug. We are able to collaborate with them, and their support is also contributing to the overall success we're gaining. So yes, government of Liberia and then partners and some local NGOs are supporting in general. The Leeward County, yes. So a few months ago, I was in Southeast. I was in Zwedru, and I had a show on one of the radio stations, and I mentioned that the fight against drug abuse is county level. So just as we have the national committee up here, the counties are supposed to have their own committees, and the county committee, under the leadership of the superintendent, supposed to include all the other partners, Ministry of Health, Ministry of Justice, and so forth. So at the level of the county, your interventions can happen exactly as we are doing it centrally. So it requires the county, the membership, the community, the citizens of the county to fight drugs, just as we are doing it nationally. Those are the three questions. Mr. Gay, thank you for the commendation. I appreciate that. Alex, you're asking whether there was a comment about whether this is a government or the civil society. So, like I said, this is a multi-sectoral committee. At the end of the day, civil society is a part, government is a part of it. We all put our hands together as citizens in every individual so that together we can fight. Okay. Some Mr. Williams, thank you for the call. He said, how can we fight drugs today? By being a responsible citizen, first of all, We encourage you not to get involved in not to get involved in using drugs, nor dealing drugs. As a responsible citizen, do not use it, do not sell it. That's the first way you can fight. Additionally, you can encourage and educate young people about the danger of drug abuse so that they too don't do it, so that they too don't use it. That's another way you can help. If you know someone in your community who is using drug without identifying yourself, you can give what we call intel. You can blow whistle so nobody know you are the one, who's providing the information. But by providing information to the law enforcement colleagues or the agency, you are able to bring to justice people who are selling drugs. Because when people sell drugs, they make the profit, but then they destroy the society, they destroy the community. So those are ways that you can help. That will be it, Mr. Wright. Over to you.
Thank you for being so concise, Doc. At this point, I want to go around the table now. Mr. Nubo, are you with us, sir?
Um,
Mr. George H. Nubo.
yes, with us.
Okay, good.
Okay. Oh, you asked if I'm with us, and I said yes, and I don't know if I have the flow.
You do.
Okay, thank you. Thank you, no, that Zia, for your presentation. Um, and you say, no, this is multi-sectorial committee. And I don't know if you are no, at the head of that committee. But I want to ask you, this committee is to combat drugs that is satiated in our society. And I want to find out how can we continue the combat if we don't even have a sniffing dog at the airport. We don't have a scanner that costs maybe up to 400 to $1 million at the airport. Do you think we'll succeed? Because the drugs still coming in. We are not manufacturing it. And it looks like, from news report, it looks like we are a transit point. So if we cannot, I feel that if we cannot find out how the drugs enter Liberia, we will not. That's my question number one. How can we fight it if we don't have these things here? Number two, this is a committee established by the government of President Joe Boakai. And our budget has gone to $1.3 billion. I want to know the dollar amount that the Joe Boakai government has invested in this committee here. Thank you. That's my question number two. Actually, I rest my case. Actually, you are muted.
Yeah, and I'm trying to unmute. But let he go ahead. Let Doc go ahead. Doc, go ahead and answer. Okay, Doc, go ahead and answer the question, please. I don't know why I delayed to unmute. I don't know.
Do you
Archie,
hear
I
me?
think you need to go out and come in, Archie.
Are you hearing me now? Am I audible? Okay, thank you. Thank you. So, Mr. Nibo, thank you so much. Those are very important comments and questions and concerns for sure. So, I have just pasted in the comment section the link to this action plan that I've just discussed. I've just pasted in the comment section. So, the National Anti-Drug Action Plan clearly considers those concerns you have about very important instruments and equipment needed in the fight against drug, especially at entry levels or entry positions or points in our country. So when you spoke about the sniffing dog, you will see as one of the interventions in that action plan that we intend to establish what we call the K9 unit. The K9 unit is the sniffing dog that you mentioned, the security dogs. We clearly have a plan in this action plan. When you go to where you have the list of activities that we want to do, you will see it there. So indeed, we are in the process. We are going to get a K9 unit for Liberia, and we are going to establish it really soon. The second thing you talk about, scanner, very important also at ports of entry, the airport, the seaport, the major borders. As we speak, the LDEA, the Liberia Drug Enforcement Agency, is procuring scanners as we speak. And when you go there in that action plan, you will also see clearly that that is one of the activities we have. So we talk about investing in technology. So those scanners are clearly there. So for sure, you got it. You're spot on. These are things that are needed in the fight against drugs, and this action plan is clearly capturing those things, and we will work to get them with the right investment. The second part you talk about is the investment, the funding, the dollar that has been put into the fight against drug abuse. The national budget for Liberia is a public document. So when you go back from 2024 to present, you will see how much money has been placed in the budget directly that is intended to fight drugs. So in 2024, the Ministry of Health received funding for what we call mental health project. That mental health project means we need to build facility so that we can treat people. Now, when that facility is completed, by the way, we are building that. Once it is completed, one of the things we'll do is to treat people who have drug use disorder. So that's a direct investment, and that was up to 500,000 in 2024 that was placed in the budget. We use that money to start doing treatment for people with drug use disorder, and then to also start the mental health project. The Ministry of Youth and Sport received money also in 2024 for, they call it, support to at-risk youth program. So you will see the amount the Ministry of Youth and Sports received. The money was also used to help to reintegrate some of the young people who had been treated, and also to do a renovation or refurbishment of a building that we are setting up now as a rehabilitation center. So the update as to all the things we've done is the second part of the presentation. But of course, I didn't put all of this out because we didn't have much of a time. So 2024, those were the direct major investments that came from the government. In 2025, and by the way, in the same 2024, there was this Kush Must Go project is in the budget. There was money, I think it was up to 800,000 that was sent to the LDEA. It's called Kush Must Go. So that was direct investment also to fight drugs. And those monies do not include personnel costs. For example, the LDEA agent, the doctors who are treating people, it does not include. So when you look at the overall investment, it is gradually increasing. This 2026, the government allocated 1.4 million in total for the multi-sectoral committee. But beyond that, the LDEA budget grew from around 4 million to over 8.6 million. So that was a direct intentional investment that shows that the government is directly investing in the fight against drugs. Are these fundings adequate? No. And that is why we keep advocating for the government to increase, the investment or allocation, but also we need to find alternative sources of funding because the government is doing many things, and the fight against drug is just one of them. So with this National Drug Rehabilitation Fund, if we are able to get support from many other places, then it means that we can have more to intensify the fight against drugs. Thank you.
Thank you, Dr. Zia. Let's now go to Claudia. Claudia, emotions.
Thank you very much. Welcome on the show. I'm happy to have you here because we've been having a lot of questions, and I really like your comprehensive update.
Claudia, you must have seen in the same bucket tonight again. You're breaking in very terribly.
Okay, let me restart it.
Oh, you okay now? Whatever you okay? Try again. Claudia, say something. Oh no. Okay. You gotta go in and out. You gotta go and come back.
Thank you.
Yeah. All right. Good. So, Dr. Zia, let me jump in. So I want to go back to some of the pillows and a lot of the things that you provided during your presentation. So give us an idea. You spoke of data, and I think I wrote that down. You said it's important to have data tracking, and I couldn't thank you for that. Because this is what I do, in my line of work every day. I track data. What are some of the methodologies you guys are using to track these data? So that, for example, like Belekatu, the retired captain asked the question, are we nationwide? And if we are nationwide, how can we interface with you and the committee, the interministerial committee? And one last thing I want to add to that. So we're talking data. Give us an idea of because you spoke of a community that is healthy, a community that is not, suffering from drug use because it has to do with our future. So people listening like to know me. I would like to know how many of our youth now. Give a ballpark. You don't have to be correct, but give us a number and a percentage if you have that information of the at-risk youth now that you guys are looking at, and how does that put the country at a greater risk? Thank you.
Thank you, Mr. Wright. Also, very, very insightful concerns. So, in terms of data, like I mentioned, we are currently building a database that will bring together all the information in a central portal that the multi-sectoral committee can view it, okay, and be able to tell exactly, what is happening here and there, especially at senior level. However, current information involving the different aspect of the intervention are currently resident with the ministry or agency that is involved. So, for example, the LDEA has its data of the number of people that have been arrested since the inception of this committee. And for example, the number of drugs or the quantity of drugs that have been arrested, the number of people who've been arrested and persecuted, the LDEA has that data. And I just have it here in a report. For example, by July 2nd, there was a cabinet meeting and there was an update. So, for example, the number of arrests that the LDEA had made in total, we have the clear numbers there. All right. So, for example, there were total suspects, for a given period from 2025 September to 2022. To June, from September 2025, excuse me, to June 2026. For example, they had around 1,167 suspects. And then prior arrests that had happened before that time from 2024 was 635. So when you put that number together, we are looking at anything around 1,000 800 plus arrests that had happened. And then all of those people, the number of convictions that were done from September to June 2026 were 8 plus previous conviction that was 38. So that number would be anywhere around 46, for example. So we have those kind of data, mostly resident with the agency. Now, these numbers, like I said, from June 2026. So these numbers do not include the more recent, arrest and all the things that are happening. No. So when we talk about at risk youth, like how many of the people we've been able to enroll into treatment, the Ministry of Health has that data. So for example, we've been able to enroll since 2024 to now, we've been able to enroll around 1,000 eight. Okay, from 2024 to it was the same uh July, it was June actually, around 1,288 at risk youth have been placed into treatment, into our different treatment programs across where we have them. So, for example, we have those data clearly and we can reflect them anytime needed. But when I talk about the data framework we were building, was to include all those live information so that at any where you are, once you have access to the database, you can be able to see it and we can easily generate reports. So in terms of estimation, like I mentioned, we have not had a national prevalence study for Liberia. However, a mapping survey was done in 2022, and that mapping survey estimates that 2 in 10 young people were abusing drugs. That means 20% of the young people. And I made a case to indicate that 75% of our population, as per the 2022 census, is below the age of 35. So you can look at what we are talking about as it relates to 20%. All right. So I think there was a question I may have missed earlier, like who was in charge or who is in charge of the committee of the multi-sectoral committee. Like I said, the Ministry of Health is the chair agency. At the highest level, the Minister of Health is the chair. And then at the technical level, I, as a psychiatrist and head of the mental health unit at the Ministry of Health, I am the chair of the technical working group. So that is about the leadership. And then you mentioned how can people reach out. So we launched the anti-drug action plan in December of 2025. We have been rolling out, since the launch, we've been rolling out the plan to the different counties. And as we speak, the superintendents of the various counties have received formal communication from the Honorable Minister of Health, which I am following up now to ensure that the county level committee is established. Unfortunately for us, we just had a health conference for the last 3 days, and the superintendents were in attendance. So I met a number of them, and I've just reminded them about the letters that they received and how we can quickly set up the committee. So really soon, the counties will have their own committees. However, nationally, the committee can be contacted mostly through the Ministry of Health because this is the chair agency. We had some numbers, direct numbers that people could reach out to access, especially if there were treatment related issues you can access. The LDA also has numbers that are hotlines and you can reach out, but we are currently trying to get a toll-free number that people can use, to contact anytime, maybe to refer a patient for care or so. So I hope that answered the questions you ask.
Absolutely. Claudia?
Okay, can you get me clearly now?
Yes.
Okay, good,
Yes.
perfect. So again, doctor, thank you for appearing on our show today. It's really a pleasure. But I want us to clarify a bit of the critical challenges, the bottlenecks and the contradictions that I have listening to your explanation of your plan. Okay, so given that Liberia really does have less than 5 functional rehabilitations, because you said we have many, but I know as a foot reporter that you have less than 5 functional rehabilitations. Dylan's rehabilitation being one, and of course, Milton Bly having 2, which I know is very functional. Where are all the thousands of youth? Because where I live, I can count up to 600 youths that are addicted to narcotics. So we're estimating more than 1,000 when they're caught in this aggressive law enforcement sweeps, because I see it every day. I saw about 3 today. Where will they be going for treatment? Because those less rehabilitation centers we have cannot host all of these youth. So I want to know, where are you going to be taking them? And it's important for us to know, because looking at your plans of punitive enforcement and the public health promising to have psychiatric evaluations and this mental health rehabilitation, it's important for us to know where you're going to get all these structures to feed these people. That's one of the questions I have. Then now we talk about corruption. We know that it's not hearsay, but we know that the securities agencies are our mold in our country right now. So how can this anti-drug action plan successfully halt? Because everything you're doing, you're trying to stop kush, cocaine, and other high-profile drugs from being in Liberia. So how do you intend to halt, especially these synthetic drugs in Liberia, knowing that the security sector holds this chaos in allowing these things to come in? That's my second question. I have one more, but I think we'll do that in the second round. So those are my 2 questions. Thank you.
Okay, thank you so much. Is the name Claudius? Sorry if I'm not getting it right.
Yes, Claudia Smith.
Okay, okay. Mr. Smith, thank you. Those are very important questions. The first one, how many rehabilitation centers we have? As we speak, we have at least 14 rehabilitation centers we are working with directly. Two of those rehabilitation centers, one in Grand Bassa and one in Montserrat, are directly being operated by the government of Liberia in partnership with another agent, with another organization, the one in Buchanan, in Grand Bassa rather. The other 12 of them are owned by private providers with whom we work. We provide education, we provide data support, we provide capacity building, on-site mentoring and coaching, and regular supervision with them. So there are 14 inpatient facilities. We have 2 outpatient facilities that the government is directly operating. One is in Congo Town and one is in Buchanan. And the reason we have those 2 counties is because of existing infrastructure that we could leverage on immediately to start providing some intervention. So that is the response to the number of facilities. As we speak, the Ministry of Health, through the county health systems, is working currently to ensure that all the referral hospitals, starting with the referral hospitals, will have what we call wellness spaces. And those are areas of service delivery where people who have mental health problem as well as drug addiction problem can come for assessment, evaluation, brief intervention, and some treatment interventions. And as needed, people can be referred to the existing facilities. Additionally, the government of Liberia is renovating, and we are 90, maybe between 97 to 98% done with the renovation work. I wish I had the means to show some photos, but we are renovating 2 rehabilitation facilities in a place called Bensonville. One is for the male, it has up to 100 bed capacity, and the same for female, 100 bed capacity. The Ministry of Youth and Sports is leading the renovation of the female dormitory, and they are nearly done. And then, through partnership with the World Health Organization Liberia office, we are almost done also with the female rehabilitation facility. So those are additional facilities. We have a current operating facility at the LRRC in Johnsonville, when we converted the area meant for refugees, we converted it into initially a temporary holding center, and eventually we started operating it as a rehabilitation facility because we had a surge of individuals leaving the street when the LDA was really massive with the rate, and then we had to put them in treatment. So that is what we have in terms of facilities. And a bigger one, like I said, we are building a national referral hospital, which is a national neuropsychiatric hospital that has the capacity of up to 350 beds when completed. This one is not only for drug addiction, but it's a national referral hospital for mental disorders in general. But then substance abuse treatment will also be included. So that is it about facilities. And like I said, the goal is to expand. So through the county committee, every county will identify existing infrastructure that we can put together, that we can renovate, we can get up and running to do more treatment. So where are people being treated? People are being treated in those various facilities. But the four facilities, two outpatient and two inpatient centers currently running directly with the government of Liberia, people do not pay money to go there. So we support the feeding, the clothing, the medication, the payment of staff, everything. The government of Liberia is funding that. And then in partnership with an organization called the Mother of Light, we are doing the one in Buchanan directly. So that's just the update. Now, this means that we need to expand the treatment access more. And that's why we are renovating, we are building additional infrastructure. So hopefully we should be able to commission additional, rehabilitation centers to house more people. Now, the other thing about, a lot of the guys are in the street, what happened, where do we carry that? Now, one of the critical things we should understand is that drug abuse treatment is a very complicated process, and treatment depends on the individual. It depends on the individual. So now you see a lot of people in the street, they're in the ghetto, they're in the cemeteries and all of that. You cannot physically force them and take them to any facility. They will not stay. So through our treatment program, we link them with an outpatient or reception point where we do assessment, determine the kind of treatment they need, and we begin building motivation with them. Those who want to go into treatment, we can eventually take them. Last year, August, a number of them came together and said, "Oh, we want to go into rehab because they're raiding our places. We have nowhere to go." That was when we commissioned the LRRC facility. So, treatment of drug use disorder really, it requires a number of things, and not just moving people into a space called rehabilitation center. I just want to make that emphasis. The issue about corruption, I believe that every human being can choose to be good or to be bad. Most times people are bad because we do not have the tight control or the system level control to ensure that they must align with rules and regulations. I believe that with great leadership, with systems, with control systems in place, people are able to align. Yes, everywhere around the world, you have members of law enforcement rather, that are corrupt. We have bad cops, for example. So the system itself has to root out the bad people. And the way bad people are rooted out is when they are exposed through intelligence, through different things, through investigation. So I believe that with great leadership, especially from above, and within those security agencies, we are able to identify the dirty cops, the bad ones, root them out, and then try to strengthen our fight. But we are committed, and the action plan clearly provides the directive in the roadmap that we can use to fight drugs. Thank you.
Thank you very much. And I mean not to make you nervous because we do hope to have you, here in the future on our program. And thank you for clarifying that we do have lesson, not just five, but lesson three fully functional. Because like you said, from county to county, as you disperse yourself, you will affiliate with other facilities. It's good to understand that fully because like I said, we know that in the next 3 months, we're going to have thousands of young kids and teenagers and young men trying to be a part of this rehabilitation program. So please let that be your first priority in making sure that this is put in place. I have one more question. I don't know, Mr. Bradley, can I throw it in real quick? Looking at time, it's very important for me to know if that's okay with you. Okay, let me get it in. All right, so doctor, I understand that your plan is to pretty much detox and provide mental health. But my question to you is, after all of this, because I have about 5 young kids around me here, I've promised to get involved in your plan because they need help. They need help. So I need to know, after all of this mental rehabilitation, drug rehabilitation, what will be next? When we talk about trade school, we talk about after vocational programs. How are you going to integrate this after your strategic mental health and drug rehabilitation? That's my last question.
Okay, thank you. So the first part I want to respond to is the number of facilities. So like I said, we work with a number of private providers and we strengthen them to deliver services. Healthcare service delivery requires both public and private. The government of Liberia does not own all the health institutions, but through strong leadership from the Ministry of Health, we strengthen private providers to deliver quality services as we want. And we are currently working with 12 inpatient facilities. The Nathan Blai facility is one of them, but there are several other facilities we work with. We strengthen them so that they can deliver quality services. So that expands the access to treatment. The inpatient facility, which is the inpatient rehab, there are two that the government is directly funding, and those ones they are free of charge. So if you know anyone who wants to go into treatment, kindly reach out. We have the center right in Congo Town if the person is in Monrovia. We have the center right in Congo Town. If the person is in Grand Bassa County, we have a center right in Buchanan. Those are outpatient centers. We bring them, we evaluate them, we start the process of treatment from the outpatient, prepare them and take them in the inpatient if their treatment warrants inpatient. So yes, treatment is available and people can reach out. Like I said, we do have numbers. I can also share them, but we are working on a toll-free line because many times people want to reach out. Sometimes they may not be able to pay for credit and all of that. So we're working on a toll-free line. We'll announce it really soon from the Ministry of Health so that people can reach us. So treatment is available and people can come. I just thought to also emphasize that the issue about after treatment, when you look at the anti-drug action plan, and like I said, I have pasted it in the chat box. When you look at the action plan, you will see clearly that there's a social reintegration piece. And we have an entire reintegration roadmap. However, it requires funding because as part of our rehabilitation intervention, we include vocational training, basic vocational skills we provide in the treatment center, especially for the people who go in the residential setting. Our program is between 6 to 9 months minimum. So people who are in that residential setting will provide basic vocational training, including tailoring, basic agriculture, catering, decoration, basic skills, computer science, and so forth. So we have those basic skills there. People who have interest and want to take up anything afterwards, the reintegration program that we designed includes several things. There are 5 major pillars of that reintegration piece. However, the implementation requires money, which true to the conversation, we do not have all those funding right now to implement it as we want. So the first part of it, when people are treated, the first part, basic social services. Some people do not have homes. They've been in the street for a long time, relatives that are willing to take them back. So those kind of people, when we talk about basic social services, housing, which we call transitional housing, is clearly in the plan. We need to provide transitional housing where people can stay for about a year after rehab if they have nowhere to go. And then we got to provide basic support like food and other basic things, so that they can be able to find their feet. So that is the first part. The second part is medical follow-up. So when people are done, they don't just leave the rehab and go. They must be linked to the clinic, to the outpatient center where they provide continuous support going back over and over based on schedule, weekly, bi-weekly or so that they can receive the support. The next thing is vocational skills development. Technical and vocational education and training is part of what we want to do. Those who want to go into, TVEC activities, we should be able to link them. And as we speak now, the Ministry of Youth and Sports is linking those who already provided rehabilitation for. They're linking them to a TVEC training. Then those who want to return to academic setting, they through the existing government institutions, we also have the plan clearly that they can go back to academic institutions. And then family reintegration is the other piece. So it doesn't matter what the situation is. Those who have families, by the time they are entering treatment, our social workers are working with the families to see how their reintegration can happen after treatment. Those who do not have families, as they are in transitional homes, sometimes they have families, but the families are not ready to take them back because of all the trauma they went through and all of that. So we continue working with them. So those are the 5 major pillars. And then by the way, the last one that has to do with economic empowerment. Economic empowerment. So that's another piece we have. But again, when you look at the plan, you see all of them there. And we are now actively mobilizing funding to be able to implement them. Government funding is there. We're working with some, but we need to do more, especially looking at the number of people who should get this support. Thank you.
Thank you too.
Thank you.
All right, Mr. Wright.
Thank you so much. Yes. Mr. Louis, I'm going to put in before we actually call the Dr. Clover. Mr.
Mr. Wright, Mr. Wright, please go out and come back.
Can I hear me?
Please go out and come back in.
Okay.
Okay. Okay. Mr. Actually, Dr. Zia, you talk about $1.4 million invested currently in a program by the Liberian government. And yesterday, the centers you talk about, they exist in Mon-saturday County and Obasa County. Are these counties the only counties in Liberia? And besides that, this is under the umbrella of the Ministry of Health. So how you will go to Grand Gila County and call on the supervisional structure the committee or the program? I believe, isn't it your responsibility through the Ministry of Health, through the county health team, to establish branch of this committee in every county? Thank you.
Okay, thank you, Mr. Nebo. Again, very important concerns. The first one I have to say is when we are starting interventions, especially interventions that we do not have all the resources for, you always do a pilot phase. You start somewhere and then you expand. So I mentioned that those 2 facilities were selected because of existing infrastructures. All right, existing infrastructure. In Grand Bassa County, there's an NGO we work with called the Mother of Light. That NGO has a facility that was existent. So we partner with them. We provided the support so that they can have a fully operational and then take in people for treatment. There was an existing infrastructure, so we leverage on it. That is it for Grand Bassa. In Montserrat, The El Triple RC facility that I mentioned was commissioned and was converted into rehabilitation center because we had a surge of individuals who needed to be taken in quickly. Initially, we set it up as a holding center, then we converted it and started providing treatment. I'd also mentioned that in Montserrado County, we are currently building infrastructure for the purpose of taking in people for treatment. However, we are working with counties through the county leadership to ensure that what we are doing nationally is replicated at every county level. When I mentioned the superintendent, I said he will oversee or supervise or provide oversight for the county anti-drug committee. In actuality, the county anti-drug committee is headed by the county health officer and is co-chaired by the county attorney, which is a direct representation of the national committee where you have Ministry of Health as the head and Ministry of Justice as the co-chair. Why did we ask the superintendent? Is because the superintendent is the head of executive in the county, and all the agencies, all the government ministries and agencies in those counties are directly under the supervision of the superintendent. So his role is to bring them together to establish the committee, but the head of the committee is the county health officer. And when you look at the document that I pasted in the chat box, you will see clearly the action plan has the different levels, the multi-sectoral committee, the county committee, blah, 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 with the term of reference and the composition. Everything that I'm mentioning is there, and you can look at it that the head of the county committee is the county health officer. So now, through the county, they can identify infrastructure, which abandoned building can we renovate, which space is available that we can invest and be able to build a rehabilitation center. All of those things now can really happen at the county level with the national government support. I hope that
Thank,
answers
thank you
concerns.
very much. Now we are in month number 8 of this year,
Mhm,
and the government has invested $1.4 million.
mhm.
Um, how much of that money is spent on Bassa and Maserati, and how much do you people intend to spend on the other counties, the counties you call leeward counties?
So the funding that comes in, first of all, I did not say the money has come. I said there's a budget. The
Okay.
national budget is $1.4 million.
Mm-hmm.
And as a committee, this is a multi-sectoral committee. So Ministry of Health, Ministry of Justice, Ministry of Gender, Ministry of Youth and Sports, Education, everybody feed into that. And part of the work we do, remember I listed all the interventions. We are doing prevention work, we are doing treatment, we are doing infrastructure, we are doing many things.
Mm-hmm.
So per year, there's a clear plan as to what to do. Under the leadership of the Honorable Minister of Health, in year one, which is year one of this plan, we are investing a lot into infrastructure. So bulk of the money is going to infrastructure to hurriedly complete the National Neuropsychiatric Hospital that I talked about, and then the other treatment facility, for example, that is in Bassa. Now they have a male side. Right now, there are multiple apartments, and we have male and female in different apartments. But what we're trying to do now is to build a separate place where we will put females, a whole compound where we put females. So those are the kind of work we are doing. And so every year, depending on how much money is available, the leadership makes decision where to prioritize, what to do with all the agencies coming together. So this is the budget for 2026. The funding has not come to say we already have it, but before it even comes, there are things that are clearly planned to happen involving all the different agencies. Thank you.
Thank you, Doc. Thank you. Oh,
Yeah, actually, you can take over.
thank you, Doc. It has been a very, very engaging show. And I want to say, please make this your home. Um, we'll have an open door for you and the technical interministerial committee. Anytime you guys want to come, please let me know. Let Claudia know. I think Claudia is also in connection with Mr. Soma, or I think Joma, not Soma, but Joma. Mr. Joma. Please let us know. We will gladly fit you guys into our schedule. Because what you have done here tonight, it's truly in the service of the nation. And I want to thank you and the committee for what you guys are doing. At least for now, we can see, and I'm saying the doctors, I'm making a comment. We cannot see, or we have an idea of what the government is doing. At first, all you're seeing, yeah, look at the kids. They just all right. You're seeing the kids going to waste, and there's nothing happening because you know why? No one is communicating what the government is doing. So we're just walking blindly. We'll fill it in the void because we don't have the information that you and the committee had. So we take what we see and we put our own analysis in there, and we say this is what's happening, and we are on a reporting because we don't have the data. So I really want to appreciate your presence here tonight. Let's make the irregular appearance because your work it's a rolling activity. You get new things happening every day as you as you encounter these youths and you deal with other government agencies. You're getting more data, and the data need to be presented to the people. The people need to know. It is their right to know. If I'm living in rehab and I see too many kids walking in the street and I don't see any intervention, or maybe there's intervention going and I don't know, I'm going to blame the government. The government is not working. Meanwhile, you guys are there. So let's make this happen, Doctor. I want to appreciate your presence here tonight. But before I allow you to close, I want you to confirm this for me. Your last name spelled as one of the major towns in Granger County. Are you from Granger?
Well, yes, you are right. That is spelled as Zia in Nigeria, but my parents are from my parents are from Grand Bassa. So I know that name comes from Grand Jide, it comes from Nimba, it comes from Grand Bassa, it comes from Riverses. But my parents are from Grand Bassa.
All right, Doc, please close. Thank you so much.
Well, thank you so much for having me. It's a pleasure to be here. I don't mind stopping by once in a while to provide updates of the various things we've done, but I really wanted to start my first appearance by providing the foundation and telling you what we have set out to do as a nation. So any subsequent appearance will really be based on, what we've said today and the specific interventions we've taken in terms of the number of things we've done. So thank you for having me, and I'm grateful to all the followers and listeners, and I look forward to coming again. Thank you.
Thank you so much, Doc. And at this point, we want to say you are at liberty to close up. You can leave, you can drive, or I can do it for you. Okay, sir. Good. Thank you. Thank you. All right, gentlemen, the time we are on the money. The time is 12 a.m. in Liberia and 8 p.m. here in the United States of America. And Mr. Nubo is making me hungry already because he's on set and he is filling up. Yes. But Claudia, that have you close, please. Since you're in Liberia, you probably want to, that have you close.
All right. What it is. I don't have the network issue, but I'm happy to have him on, and I'm happy to know that they have all this stuff going. We are going to put them to task because, like I said, where I live, it wastes, the youth waste. And I have a few that I'm mentoring. I have a few that I'm trying to get involved into being alive because they've completely just died with everything as it relates to living their lives because they're consumed by habit. So I'm hoping, Mr. Wright, you can get us in touch with him so that will be able to follow some of their, activities, get some videos up so that we can see visuals of what they're actually doing in Liberia. It's been a good night, and I appreciate all of the panelists. As always, have a good night.
Thank you, Madam Claudia Emotions, Claudie Smith. Absolutely, we'll continue to engage with him. Make sure that he become a regular on the set. And yes, the next time he appears, you're going to be showing your videos and pictures as well. He has them. It just slipped my mind. We were talking earlier today. He talked about it. I could have said, well, you hit it, send it to me in my inbox, and I'll put it up while you're talking. So we'll do that next time. And thank you so much for being part of the set tonight, Mr. Nubo, Mr. George H. Nubo.
I'm here. It was a great night, but what he was talking about, I didn't see the commitment to national agenda. They started this 2024. And this year, they got $1.4 million. And the only two places he can talk about are places they are retrofitting, in Grand Bassa and Muscle County. Does that cost $1.4 million? And then what happened to us, we who are in the counties they call leeward counties? Are we not part of Liberia? And it's good you ask, but I don't want to blame him on that, because he has some bosses. But I feel that Bassa and Monserrado counties are not Liberia. The last time I checked, we have counties called like Grand Gideon or Maryland, River G, River Cess, or Bon Nimban, or Lofa, or Bapuru, Bumi. We have the counties. And the government gave you $1.4 million. And you are only concentrating on two counties, then that is not a good agenda. Are they saying that there are no people who are addicted to drugs in those counties? Are they saying that the addicts are only in Monserrado and Bassa County? I mean, I feel that they need to do better. I rest my case.
Thank you, Mr. George H. Nubo. I think you raised a very good point there, and this is why we want to bring people like Dr. Zia on this platform, because we can raise the kind of relevant questions that you just put forward and concerns. Well, not questions or concerns that you just put forward, and he would address them. You know what I mean? I think he talked about engaging with the superintendent, so we can see there's a step in that direction, but we want to make sure that step is not just on paper. That step is coming to fruition, and that everybody, like you call it, it's a national approach. We're sick and tired of these things where everything is happening right there, within the 2 hours radius outside of Monrovia and then Buchanan and then stay Kakata and stay right there. And you got to get out too. There are other Liberians everywhere. Thank you, gentlemen. It was a great show. The time is 12:05 in Liberia and 8:05 here. I think we have done ourselves a justice tonight. And I will see you here back tomorrow, same time, same place. Good night. Mr. Chris Watt. Yes, sir. Yes, sir. Yes, sir. Yes, sir. Mr. Ware, are you there?
Yeah, I'm here. I am here.
I don't think Chris is around.
You got me?
Yes, we got you.
Good, thank you. I am here. I'd like to say thanks so much, Mr. George H. Numbo, Madam Smith, and the host, Mr. Wright. And the show were great. And I appreciate every one of you. And God bless all of us. Bless our listeners and our follow-up. And we'd like to say thank you. I bet to D4 take break, and we're going to be back tomorrow, the same time, the same station. Have a great time. Bye-bye.
Good night. Good night. Good night. Good night. Good night. Good night. Good night.
I beg to differ, Liberia. My people, Taibo. Top FM 105.3, we on the air. Leader.
thos FM